Thanks so much, Riley. Well, it's Tuesday, which means we get a chance to talk to Greenwood LaFleur Hospital, and it's all about your health and making sure you stay healthy and take care of it. This morning, we're joined by Dr. Craig Clark of the LaFleur Neurosurgery Clinic. Dr. Clark is a board-certified neurological surgeon. But Dr. Clark, you also have a PhD in healthcare administration, which kind of takes us where we would really like to touch on your expertise this morning. Mississippi is kind of in an interesting position right now in healthcare, and some people are calling it a critical condition. Why would you state that the state of Mississippi and the status of our healthcare is in critical condition in this state?
Well, you know, it's not just Mississippi. It's all the states. And we're in a process of evolution now where we're beginning to see some of the long-term consequences of the Affordable Care Act, Obamacare, and many points of national legislation are now coming home to bear. And that affects not only the individual consumer of healthcare services in Mississippi, Tennessee, Georgia, everywhere, but also the institutions that deliver those services as well. And so both are experiencing severe stress, mainly in terms of financial stress, but stress otherwise, in terms of access, availability, delivery, all those different parts of the delivery of healthcare services. Back when all of this started, you know, the Affordable Care Act made several presumptions, and that was how this whole thing came about. Traditionally, the average American, the average Mississippian was employed and relied on group health insurance. And so when the Affordable Care Act passed, there were several things put into that legislation that required all of these group health plans to offer maternity care, to offer behavioral health services, to offer a wide variety of services that made the plans very, very expensive. It also changed in that it required the insurance companies that were writing these group health plans could no longer do experience rating. In other words, they had to do what's called community rating. So a 40-year-old African-American male with a terrible health history pays the same premium as a 40-year-old African-American male who's in excellent health, who works out, who eats right, who tries to do everything he can to stay healthy.
Let me ask you this really quickly. It's clearly a complicated system. It was complicated beforehand. As you look forward to the future, do you think that there are things that we could do today and or decisions that are being made that are going to help, especially those in the state? Because there's a lot of people in the state here that are at a lower income. What decisions need to be made going forward?
Well, the major problem with that, of course, is that Medicaid has always been the federal program that offered or financed services for the underprivileged, if you will. And when the Affordable Care Act was passed, there was the presumption, again, that everybody would have health insurance, and therefore it would no longer be necessary to subsidize the delivery of underpaid healthcare services, be it to the uninsured or to people with Medicaid. And there were programs, you know, there was a program called the Upper Payment Limit or UPL program that was based on fee-for-service delivery of Medicaid. Well, when the state of Mississippi went to managed care Medicaid, that money tends to go away. Although there was a separate program that was passed to try to ease the burden.
So a lot of choices need to be made going forward. Let me ask this, following up, because we've got to finish out in just a short time. What can folks in Mississippi do right now to kind of make their voice heard on healthcare situations?
Well, I think regardless of whether you're a Republican, a Democrat, an independent, or just an interested citizen, what everyone has to do is register to vote, make sure that our representatives understand how important this is to the individuals in the state. And as individuals, I think we all need to support our local facilities that offer these services. Because if we don't support them and they go away,
then we don't have any.
We have nothing. Yes.
Fantastic. And Dr. Clark, thanks so much for being here. I know it was short, big subject. We'd love to have you back one day to talk more about it. Thanks for being here this morning.
Very good.
Stay with us. We've got more coming up after the break. We'll be right back.
This Health Matters segment is brought to you by Greenwood LaFleur Hospital.